Spencer. Thank you so much for joining me today. I'd love to ask you some questions about your career. So if we could start off with your name, title, and organization.
Yeah, happy to be here, Danielle. Spencer Jones. I'm currently the CEO at Lapovations. Lapovations is a startup medical device company in the laparoscopic surgical space. We're based out of Fayetteville, Arkansas.
Very cool. Let's see. Could you briefly describe what led you to your current job? And if you could include any details, like if you always knew you wanted to do this, have you had any unsuccessful work experiences or successful? Any promotions that led you to this current role, which is an incredible role? Yeah, if you could tell us a story, that'd be great.
Yeah, so I went to graduated from Conway High School. And then knew I wanted to do healthcare in some respect, and then went to the University of Arkansas. Started off pre-med, was really bad at chemistry, and then I blame a couple things, probably just me being too immature at the time. But anyway, so switched from pre-med to nursing, and then kind of had the idea that I was going to go into anesthesia. So graduate from nursing school, you work for like 2 years. And then you can go back to anesthesia school and be a CRNA. That's what my dad did for 36 years. And I said, okay, well, that's what I want to do. And then probably about, right as I was getting into the nursing workforce, so like graduating and working as a nurse, I just was, I was working as kind of a tech CNA during school, and then an LPN, and then an RN once I graduated. And so I just kept experiencing things kind of firsthand with direct patient care that were just incredibly inefficient and needed to be better, work better, whether it was devices or supplies or processes. And so that kind of led me to think, what if we had a device that did this, right? And so ended up filing patents for some devices in the vascular access space back in 2014. So this was only like a year out of me graduating from nursing school. And, filed those patents, and then through kind of a series of, business accelerator programs and then entrepreneurial support organizations, ended up, really starting a business around it, raising capital. That allowed me to kind of quit my full-time job as a nurse and do this startup full-time. And so that first startup was Lineus Medical, which I was there from 2015 all the way through 2022. So 7.5 years. We took that device from literally an idea all the way through FDA clearance. It was class 2 de novo, did a big, 300 patient clinical study with it. But anyways, I'd say that, experience with, those devices and Lineus is kind of what set me up to be in this position at Lapovations for sure. I'd say, that more than anything. And Lapovations was also an Arkansas-based company, so I think there was a little bit of kind of geographical proximity that helped me get here too. But yeah, that's kind of the high level of how I got to where I am today.
Wow. So you went to school for nursing, but you ended up being really passionate about entrepreneurship and innovation. And it sounds like you were maybe surrounded by innovative people and people who understood how to take an idea, maybe from an idea to fruition. Mm-hmm. Did you have a good support system for that, or did you have to seek that knowledge out yourself?
Yeah, I'd say I definitely had to seek it out. I mean, there were some, I wouldn't say that I was initially surrounded by people that knew how to take it from A to B. But there was a lot of good entrepreneurial support organizations. I just call them ESOs for short, ESO. A lot of ESOs in the state that help get me in front of the right people and make the right connections. I'd say, Innovate Arkansas, Startup Junkie, the Venture Center at the time. There was just a ton of really good people within those organizations, and then those organizations themselves that either they could help you directly, or they were like one connection away from somebody that could like really be a good mentor or really be a good asset or resource for you. And then I'd say too, like doing the accelerator programs, that's really kind of what engulfed me and like helped create an even better, support system. I did the ARC challenge down in Little Rock, and that was kind of like when I feel like I got kind of fully enveloped and had a support system around me. And then even more so when I did 0 to 510, which is another accelerator program in Memphis. Coming out of both of those, I mean, that's one of the big benefits of an accelerator program is you kind of like, expand your network. And there's a lot of people that sign up to be supporters or mentors or whatever for those programs. And so you kind of get immediate access to all of them. So I'd say initially, though, I really had to seek it out. Like I, went to my old boss. I was selling clothes like at the very end of college at the time and had this idea. And he was like, you need to go talk to Jeff Amarai and these startup junkie folks. Right. And so, and then Jeff, that's what got me in with Startup Junkie and Innovate Arkansas. And then they were like, you should apply for this accelerator program. So it was kind of like one connection leads to another 2 or 3 connections, leads to another 2 or 3. And all of a sudden, I was in front of, kind of had that support system you're talking about.
Yes, I'm so glad you're sharing all of that, but because I think young people often don't really realize the benefit and the strong correlation between success and these big ideas and having the right people in your corner, not just to tell you exactly what to do, but like you said, to make those connections and say, well, maybe you should talk to so-and-so and building out a group around you that can really support you through success.
Mm-hmm.
So CEO, I think that is quite the broad term that most young people don't even know what a CEO does. So do you care to give us a quick rundown of, we're going to get there in a minute, some more details, but even just something quick of what is a CEO, Spencer, for a medical device company?
Yeah. I mean, just at a high level, the CEO, chief executive officer, they are kind of at the top of the org chart. Typically the CEO is basically like the highest employee at the company, but then the CEO still reports directly to the board of directors. So like even the CEO to a degree like has its boss, if you will, right? But the CEO, I mean, the day to day is going to change, is going to be completely dependent on what the company's stage is, and then size of the company, stage of the company, and then the industry that it's in. For medical device companies, especially in the very early stages, the CEO is more than anything doing project management and, handling finances, HR, fundraising, and then setting the strategic vision for the company, right? Like making sure that the company's vision and mission and values are kind of where they need to be, making sure that's communicated all the way down through, management and any other level of employees that you have. Making sure that there's good company culture. Culture starts at the top. So like how people are treated, what the expectations are, kind of how fast the company moves, how methodically the company moves, right? All of those things really do get set by the CEO. So it's a lot of, in the weeds stuff at times, with an early stage company. I think as you grow to be a larger company, there's a lot more focus on, putting people in the right places. You're probably less in the weeds. It's more kind of strategic vision. What projects do we want to move forward as an organization versus like you in those projects moving them forward, right? And that you'll hear this term a lot, like working on the business versus working in the business, right? Like when you're a CEO at a startup, especially a med device company, you're really working in the business a lot. Like you're in the projects, you're in the meetings with it's the org chart is a lot flatter, right? It's a lot, less levels to it, right? So you're in the business more. And then I think as you grow, you're working on the business more, right? You're moving pieces around in projects and departments and budgeting and staffing and strategic investments and X, Y, or Z. But yeah, that's, I'd say specifically though, to kind of get a finer point to answer your question, CEO at a med device startup is very focused on product development, clinical and regulatory, which kind of goes hand in hand with product development. And then your capital strategy, how are you sustaining the company? Is it grant funding? Is it venture capital or private funding? How are you going to reach, commercialization? And then how are you going to get to profitability after commercialization? Do you require additional fundraising rounds? So all of that capital strategy, product development, regulatory, and go-to-market strategy, that's really what an early stage med device CEO should be thinking about, every day.
Yeah, those are lots of high level terms, but I get, I know what you're saying as we share some background, but Um, as a student, I think being a CEO is one of the most rewarding and interesting jobs. And it's kind of obscure, and you have to have a career before you become a CEO. But I think hearing directly from people who are in the trenches of those jobs and really get to exist, especially in startups, it's just such a fun job. You get to wear a different hat every day often. And like you said, you get to be people first and really focus on the culture and creating a place where people want to work, and you get to help create the vision that people get excited about. So, I mean, from a student's perspective, that all that other stuff is probably a bit of mumbo jumbo just at where they are in their knowledge. But the aspiration to become a CEO, I think, is something that I hope that they take from this and say, wow, Spencer's got a really interesting career. I'd love to pursue something like that. So moving on though, what education or experience did you have to attain your current job as CEO, but also, as you became a nurse, if you could share that?
Yeah. I mean, I think, one, from an education, kind of an exposure background, something that most entrepreneurs have in common is that they have like direct experience with the problem that they're trying to solve. For me, it was like my nursing education, put me in a place to be working in the hospital and in, orthopedic rehabilitation clinics, in long-term care facilities like nursing homes. So my education, that clinical education, was critical because it put me in those places, in those care delivery environments. And it was only after I was there that I was able to like experience these problems and think, oh, well, this device is inefficient, it could be better, and so on and so forth. So I think that, like, at its core was like really, really critical, right? The clinical education and experience. And then I'd say that's what gave me kind of the education required to kind of like have the problem and kind of develop the solution, if you will, at least like conceptually. I'd say to be a CEO, like, it took a lot of education and training around kind of like all the non-clinical parts of running a business, finance and kind of some basic accounting principles. That was really important. The regulatory and reimbursement side. Just kind of like, general business administration, if you will. How HR works, how payroll works, general practices around hiring people, and all of that stuff I kind of learned on the fly and learned through the accelerator programs I went to. That's one awesome thing about it, right? But I know it may seem daunting, but whether I gained that knowledge through accelerator programs or just through like reading books, it was a combination of both, right? And so just because you don't, I didn't have, coming out of nursing school and just initially starting the company, I didn't have any of that education or formal education or knowledge base, but I was able to learn it pretty quickly. I call it like being in sponge mode, where like you put yourself in environments where you're like, everything's new and you're constantly learning and you're just like soaking up as much as you can. And
Right.
these accelerator programs were only 3 months, so it's very compact. But if you kind of have that attitude of like, I'm going to soak up everything I can, whether it's, finance, accounting, but I'd say too, thinking like, kind of broadly here, one of the skills, two skills that I could say, like, from an education and training standpoint, like, continue to pay dividends. It did when I was starting the company. It continues to pay dividends. I would say like writing, like creative and professional writing. I don't know if professional writing is like a term, but like just being able to like really eloquently like make an argument, define your thoughts, and like think of even like a book report or like an essay, whatever. Like, I was a really good writer back in the day, and had really good AP English teachers and such. And I really think like the ability to like think, read material, think critically, analyze it, and then either summarize it or make a compelling argument for why you think, this is the theme or this was a problem with it or whatever. Like, that is so critical, because like whenever we're going back and forth with the FDA, like, they're providing an objection, we're analyzing their objection versus our evidence and our data and our device. And then we're literally drafting and writing an argument, right? It's like an essay going back to him. So that kind of critical thinking and critical writing is so important. The second thing I'd say, final point on this, is being, and this is going to sound dumb, but like being good at searching search terms and Googling. I know it sounds dumb, but like there are so many resources and assets on the internet that you like don't even know about. And like, I can't tell you how many times people are like, oh, I don't know if this exists. And it's like, it takes 10 seconds to go search and find it. So like, I think that kind of goes along with just being resourceful and like, I'm going to be able to find this. I know how to search. I know how to manipulate search terms. I know where to search. And I think that's becoming even more and more prevalent in the way that you like query, Chat GPT or other AI ML based models. Just because like they are kind of a new way to search, right? And so making sure, or understanding like how to build prompts, different things like that it's kind of related to your traditional Google search. Like all of that stuff's just critically important, because if you're better at that, right, you're better at finding information that's more accurate more quickly, and that's just going to make you a better business person in general, right?
Yeah, I actually love all of that. Second it all. In my experience, you don't have to know everything. You just have to know where to look or be willing to find it. And like you said, the internet is just this wealth of knowledge. And now we have Chat GPT and like you said, models like it. And we just have to gain the skills to be searchers and find the knowledge to get to the next level or to answer our question or overcome that challenge that's in front of us. So I love that. I think it's applicable to so many jobs, not just our experience in med device development and running companies, but that's great. Could you touch really fast on what your pathway looked like from high school to nursing and getting into a career in nursing?
Yeah, so graduated from Conway in like 2009. Went straight to the University of Arkansas. Took like 2 years of prereqs, basically 2.5 years of prereqs, prerequisite classes to get into nursing school. And then, along that way was applying to nursing school and got in. Nursing school was 2 years, graduated in December of 2013. And then applied for jobs all over. Back then, it was really tough to get a job as a nurse. Now it's a lot easier. But so got a job, started summer of 2014 in Little Rock. That was like, bedside med-surg nursing. And then worked there from basically the summer of 2014 to the summer of 2015 as a nurse. And kind of the whole time I was there, I was like kind of moonlighting or working on the device stuff on the side, and actually did an accelerator program for part of that. And then it came to the point where I got an opportunity to do a accelerator program in Memphis, and they were like, you have to move here, which meant like I had to quit my job. But I didn't quit my job yet. I just went to them, and I was, keeping my employer in Little Rock at the time, like up to speed on everything I was doing. And I said, hey, I've got this opportunity in Memphis. Can I take a 3-month leave of absence and then come back if it doesn't work out? And, retaining employees is good, and hiring and training new employees is hard and expensive, right? So they were like, sure. Like if it doesn't work out, like they were kind of supporting me in the opportunity or supporting me already. But anyways, I say all that to say, people think like you have a good idea and you quit your job sometimes. Like, no, like you really wait as long as you can before you're like, okay, it's painfully obvious that I need to quit my full-time job to pursue this side hustle thing. And so that's what I tried to do. But anyways, but yeah, that at that point, 2015, took the 3-month leave of absence, basically was at Linnaeus for until the end of 2022 from there. And then I had been kind of an informal advisor, mentor to Lapovations for years. And so whenever I left Linnaeus, it was just kind of a natural next step to come on full time with Lapovations. And that was from the end of 2022 until now.
So interesting. Okay, so we've answered some of my questions that I have written down, but I think it'd be interesting if you could share what an average day looks like for you at Lapovations, because I'm not even familiar with what even your products are like at Lapovations, and I'd love to know a little bit more about, what do your days look like there? What are you working on?
Yeah, so our main product is called AbGrab. It's a laparoscopic surgical device. So just basically, and without getting too in the weeds, at the beginning of the surgery, for a lot of surgeries, they have to like lift up your abdominal wall so they can poke something into your belly, right? So we make a device that helps lift up the abdominal wall. It basically uses suction to lift the abdominal wall, right, to make that process easier and safer. So, we launched our product basically at the very beginning of last year, and so my focus has been very sales and marketing focused. We're a very small company, so I take on like basically all of our, I'll call them like customer facing or commercial activities. So strategic accounts, working with all of our sales reps. We have 45 1099 sales reps across the nation, which means they're not like our direct employees. They're just kind of distributing on behalf of us. But they sell other people's products too, right? We just pay them a commission. So I'm interfacing with them, going to conferences, doing, marketing spend, managing our marketing spend and what conferences we go to, physically being there, doing all of our sales rep training, kind of managing our sales funnel, right? Opportunity funnels and, where people are in those funnels, keeping track of all potential sales and that kind of stuff. And then, paying commissions, I'm running payroll. I'm, making sure that, we have our bank accounts set up and there's enough money in this account, right? Like some of that basic executive administrative functions. Then yeah, looking at trying to keep my eye also on like what's, in the future, right? Do we have a second product, doing diligence with potential second products and, looking at pricing, what, how do we need to change our pricing? Do we run different promotions? So it's really, there's a lot of kind of in the weeds stuff related to kind of ongoing, executive administrative functions or like week to week, month to month sales stuff. But then there's some, big picture, what's our marketing campaign for this year going to look like? And what's our pricing strategy or, promotions going to look like from a sales side this year?
Yeah, that's great. Shared a lot of really good details. I think that give us a better picture into what you do, what's a CEO do, but what's a medical device company, what's the inner workings of one of those look like. So what would you say is the best part of your job, Spencer, today? What's the best part?
It's a good question. I'd say I really like working on lots of different things, different. And when I say different things, like, I may do something that's kind of engineering focused for an hour, and then I'll switch over and I'll look at, I'll talk to sales reps on the phone for an hour, and then I'll work on like a marketing campaign and like figure out, okay, we're going to do a survey with all of these different OR nurses, right? So building that survey and figuring out, exactly what questions we want to ask them and kind of what are our criteria. And then, looking at finance stuff, right? So it's just kind of being able to kind of switch gears and work on a lot of different things. I mean, I personally also really like, kind of having the flexibility with my schedule. I work from home right now. It's not always been that way. When I was at Linnaeus, I didn't work from home for, the majority of my time there. But when you're working at a startup, especially if you're kind of like one of the founders or on the executive team or whatever, you really have like a ton of flexibility with your schedule. And, that doesn't mean that I take off, like I'm on vacation all the time. Like I actually probably take far less vacation than like most people. But I can kind of take off when I want, right? I'm not like submitting a PTO request or paid time off request, you know what I mean? And like going through this, it's really kind of flexible, which is just nice. And, if I need to go run an errand in the middle of the day, I can just go do it, right? I just schedule around it. So I'd say I love the variability in what I do. And I love the flexibility with my schedule. And one other kind of final point too, like I think, one really fun thing about working, entrepreneurship is that you sharpen a lot of your skills that aren't like, if you go to engineering school or, go to college and you're an engineer and you go work for a massive company and you're engineering for that company, they may have you doing very specific engineering tasks and you may become one of the world's best engineers within this, specific vertical, right? But I'd say entrepreneurship is, and that's great, and there's nothing wrong with that, right? But entrepreneurship is kind of different in the sense that you're going to have to sharpen your skills to be a good entrepreneur with, clinical and engineering and product development and finance and business administration and, all of these different kind of verticals, right, if you will. And so what that ends up giving you is like a really broad, diverse skill set, which kind of makes you a Swiss Army knife, right? Like you could be plug into any organization and be very valuable, right? And drive a lot of value for, I don't care if it's a snow cone stand or you're, making orthopedic implants, right? Like once you've developed that kind of broad, diverse skill set, like it's fun because you can see yourself, you kind of open up your opportunities, right? Employment opportunities, because startups don't last forever, right? Sometimes they're successful, sometimes they're not. But either way, they don't last forever, right? So it prepares you well for the next thing.
Yeah, I think those are great points. And through my experiences as well, in a startup med device company, it was wonderful to be able to touch all of these different pieces and constantly learn something new and be a part of big picture conversations, like you said, in marketing strategy, in operations, in engineering. And you were just constantly like this sponge that learned. And it has been such a benefit. Just like you said, it doesn't matter what company I'm talking to in my consulting business, whether it's med device or whether it's a small business that, makes products locally. I'm able to add value, and that feels really good. And so I think there's a lot of people really thrive in being an expert in one area. And like you said, that's super valuable, but some of us really thrive being generalists and having a wide knowledge. And I think it's good to hear from people who thrive in that environment as well. Okay. So we've talked about the good. Tell us the challenging stuff. What's the most challenging part of your job?
I think there's probably the pressure. There's a good deal of pressure, especially when you're doing entrepreneurship for the first time. You can imagine, like, I remember it as a 26-year-old, I was had raised, over $1 million in venture capital funding and angel capital. And, there's a lot of people that you feel like are like betting on you, and so you feel a lot of pressure to perform. And then I think, that I could handle the pressure. Like the pressure wasn't, I think, what was difficult. I think the difficult part was feeling kind of like losing yourself a little bit, where like your identity as a person was wrapped up in your role in the business. And I think it's it's difficult to, but you have to really separate, the performance of the business is not who I am. I am who I am, and I have this role at the company. And it's a fine line to walk, right? Because you want to be incredibly invested and like eat, sleep, and breathe, the success of your business and all of that stuff. But at the same time, like you have to, like, for your own health and conversely for the health of the business, you have to take care of yourself and like really make sure that you are personally invested in your support network and the relationships around you, and you have your own identity. So I think kind of that like perception, persona, pressure kind of element really gets a lot of first-time founders, frankly. So that's difficult. I think people are hard, especially I've seen a lot of founders that are very technical or very clinical, and they want people to shape and mesh around them, and I've seen people struggle or butt heads or whatever. And so I think building a really good team is just difficult, right? You want a balance of people that are going to challenge you, but also people that want to work with you and like be flexible with you. You want to bring in people that are different than you, right? And sometimes that's difficult. So I think, again, going back to like developing a broad set of skills, like people skills from like a management perspective is something that you have to really refine as a leadership skill, right? So I think just the people element and making, managing people and relationships, whether it's new employees or investors or board members, like that's so difficult, right? And it's hard to know, who to trust sometimes. And so I'd say the people part is it can be challenging. I mean, currently at Lapovations, like we've got great people, got great people in our company, great people in our board, lots of people that we trust. And so I think last thing I'll say on the challenging part is, you know, there are always going to be variables that are out of your control. And so I think just as a, CEO, like really trying to understand what variables are in your control or what things you can control, what things are not in your control, and how to best kind of mitigate, the risk or mitigate the impact of those things you can't control, right? Because it's a fool's errand to try to like right now there's some like price sensitivity with hospitals, right? So you can either keep trying to fight that, or you can just say, how are we going to roll with the punches here and change our strategy so that we can turn this, kind of turn this from a challenge into an opportunity or what have you. So I'd say just having things impact your business that are out of your control, it's always challenging and frustrating. And just knowing how to spot those and how to overcome them, that's very challenging.
Yeah, good. Lots of good points I can relate to for sure. Okay, so you've had an incredible career, Spencer. You're still very young. What's your long-term career goals? Is this path that you're on right now? Or are there anything additional, any side streets that you might take? Anything else you want to share?
Yeah. I'd say I've kind of got two big picture goals. I mean, obviously, I would love to sell, the companies that I've been a part of, see a successful exit or acquisition from those. I really, the kind of venture capital space, raising a fund and then placing investments in companies like the ones I've started or work for now. I think the finance side is something that's really interesting to me. I think, being able to like observe and assess and kind of grade companies and opportunities is something that I've like developed a knack for. So I think long term, I would really like to get into the venture capital space. I think there's an opportunity for a little bit more active portfolio management, like from basically the companies you invest in having a little bit more active role. I think that could be a really interesting spot for me to land. So that's really interesting to me.
Hey, Spencer,
Yep.
Can I pause you? And just for the student's sake, or anyone who's not familiar, what venture capital is, could you give a brief?
Yeah. So venture capitals, they are basically investment funds that will raise their own, money from, high net worth individuals or any number of sources. They may raise a $50 million venture fund or a $100 million venture fund, right? And the whole goal of it is they say, hey, we're going to go out with this $100 million venture fund and we're going to make 25 investments over the next 4 or 5 years, and we're going to invest in med device startups, right? And they're going to invest anywhere from 1 to 5 million in each company. So that, and the whole idea is that they can return or generate a significant return on return on investment for their investors, right? So that's a venture capital fund. So basically the people that make big investments in startups, those are typically venture capital funds. So I think it'd be really fun to work for one of them. The other thing kind of coinciding with this long-term goal is the med device and kind of med tech startup world is just like very it's kind of a closed door industry almost, and there's a lot of knowledge that's kind of gate kept, and it's just hard for early stage med device and med tech entrepreneurs to like really know what to do or where to go next. And there's just a lot of very specific knowledge. So something me and a partner might have been working on is kind of like a course and a community to help get that knowledge, to the people that need it in a very digestible, accessible, and affordable way. And also kind of create a community around it. So where, you feel like you're in the trenches with people that are, experiencing and going through similar things. So that's something that I'm hopeful that we can launch this year. It's called Exo MedTech. And so I'm really excited about, the potential for that, just because I think, if you're an engineering student or a clinician with an idea, or a surgeon, even with an idea or what have you, the idea is that you could take this course, may take 8 hours, and that you'd come out the other side with a really dangerous amount of knowledge and skills, templates, resources, access to a community, vendors, databases, all that stuff.
I think that's an incredible idea. And from my experience would be incredibly valuable to baby startups, really, really baby startups. Because like you said, the knowledge is out there, but you spend so much time finding it. And to be able to have it in one place, and like you said, with templates or just knowledge that's condensed into one place, enough to be dangerous and know the right questions to ask or the right consultants to seek out to beef out that knowledge would just be incredible. So awesome idea.
Yeah, it's just like, it's like I just hiked through the woods of doing med device stuff for like 9 years. And it's like everything I wrote down and everything I learned, right, and everything, it's like if I could go back to the beginning of that trail and there's a bunch of people trying to start the same journey and I could just hand them a guidebook, right? Like I wish I would have had this. That's kind of how we built it. You know what I mean?
Yeah, that's incredible. Congratulations on that. I think that you're going to make a huge impact with that.
Yeah.
All right. So what advice would you give to students looking to find a career they enjoy? We know there's more pieces to the puzzle and more things that they should be considering other than just passion and, what they want to do every day. But I'm a firm believer that if you love what you do, you'll never work a day in your life, but that you can be successful and make a living at anything, truly. So what advice would you give to students?
Yeah, no, it's a great question. I mean, I would say, the where you are now, and I'd say, people may have different schools of thought on this, but like the years between, I'll say 14, and start as early as you want, but up until, your mid 20s, early 20s, like those years are so formative and so important. I think you go into the brain chemistry of neuroplasticity and whatever, but basically you're able to learn so much more, and the teachings and the learnings you have, when you're in that kind of age range is just so impactful, that I would say just really lean into doing the hard work and really challenging yourself. And it's not just for a grade, like, right, you're not doing it for a grade. Yes, you want good grades, you want to have straight A's, all that stuff, but like you're really investing in your future, because the education that you're getting and kind of the skills that you're developing at 16 and 18 and 22, right? Like that's what's going to set you up to be a high earner and to be able to have the life you want to have later on, right? So I'd say just really invest and lean into the education thing, specifically for career paths and such. Try to figure out yes, what you're good at, but like more basic than that, like what you have a knack for, right? Like I was not great at math, right? The chemistry is kind of a form of math, really, if you think about it, right? But wasn't great at math. But biology, microbiology, anatomy, physiology, I was a very visual learner. Like I could, trace the circulatory system all the way through, right? Labeling everything. So I gravitated to the medical side. I gravitated to the biology side. I gravitated towards kind of that like more visual learning mediums, right? And so that's what I leaned into. So I'd say if you're trying to figure out like, what do I like to do? Don't think of it as like I like to fly planes, right? Like, you may be really into kind of like, you may have a skill for math, or you may have a skill for engineering or something physical, or maybe you like working in abstract, kind of more abstract, like physics type, math, like whatever your penchant or what gives you energy, right? What do you like doing? Really try to lean into that and then just keep developing your education around that. Like for me, it was, I'm in AP bio in 10th grade. I loved it, right? So I kept leaning in. I'm taking microbiology lab, anatomy and physiology 1, these courses in college. I keep leaning in, and all of a sudden I developed this clinical knowledge and this clinical base that's really, really good. For someone else that could be, I really like computer science, right? And so you take computer science classes in high school, you get a computer science degree. Then you find, I really like systems and network engineering, right? So you get a specialization in systems and network and cybersecurity. And then all of a sudden, right, you've got the education and the industry exposure to go start a company in the cyberspace, IT, whatever, cybersecurity that you're really passionate about, right? But it took leaning into that interest and that aptitude for you to be in an environment with the right education and the right exposure to take advantage of the opportunity when you see it, right? So I would say lean into your aptitude. And if you're having trouble and you're like, I don't know what my aptitude is, talk to your teacher, talk to your parents, talk to a mentor, and try to figure out, hear it from other people. What do I have a knack for? You may not see it. It may not be obvious to you, but I guarantee you each and every one of you listening to this has something that you're good at and an aptitude for something that you can leverage.
I think that's a great point. Sometimes we don't see our own greatness or our own aptitudes, as you said, and it's really helpful to have those conversations with others. They're kind of uncomfortable to ask someone to brag on you, it kind of feels like, but other people can see us better than we see ourselves often. So I think that's great advice.
And can I say one more quick thing too? I think, and I'm only 32, so I'm not like some super old guy, saying this, but like, I think one thing that's just really key, yes, to entrepreneurship, but just in general, is just being coachable. And like, sometimes what that looks like is being able to take criticism constructively and not take it personally, but take it as someone trying to help you. So I think that's one thing. Our culture is very positive, like everything's, blue skies and rainbows and it's all positive feedback and whatever. And on the flip side, people can be very mean when they're not being positive, right? But it's like, we always look for that positive affirmation, and it's not fun to hear negative critique. But just remember, if it's someone you respect and someone you trust, they're only giving you that negative feedback to help you get better. And so I would say small point, just try to be coachable. Because I think when you're starting a new job, like if your employer sees that you're coachable, like they're going to love you so much more, right? If they know that they can tell you how to do something better and you're going to take it on the chin and do it better, right?
Great advice. I've seen a lot of very brilliant people, students specifically, who haven't struggled a lot, even in high school, and things come very easy to them, walk into college or the workforce and really struggle with that point that you make, because they haven't struggled yet. When they're set up to learn something new and it doesn't come super easy to them because it's outside of what their core knowledge is, it's hard. That's a really big challenge. So I think I would even add on to that, like seek opportunities for that. If it's not coming naturally in high school, even in college, if everything's always positive, seek out opportunities to learn what you could do better, or put yourself in a position where things aren't so easy, because those are core skills that everyone needs. Like you said, to be coachable is just so important in the workforce, and definitely entrepreneurs. You don't think so. You think you're the boss, but that's not how it works at all. You're always there's always stakeholders, or there's always somebody who sees what you're doing a little bit differently than you, and you need to be able to take that feedback and grow and improve whatever you're working on. So good advice. All right. So some of the students are currently working on, or some of the ones that I've been working with are working on resumes and cover letters and interview skills. And that's not something we think about a ton in high school, but and it's often not a things that we're learning. We kind of fail a bit at it if it's not something we have an aptitude for right off the bat. So, Spencer, what advice would you give to students to prepare for an interview? And I think it would be great if you could tell them what you'd be looking for, even when you do quite a bit of hiring and historically have. So what are you looking for when you're interviewing, especially entry-level positions, if you've got history with those?
Yeah, no, we've hired some entry-level positions before. I mean, honestly, I think being, you can tell if someone's prepared for an interview or not, like almost immediately. But I think, being able, just communication is honestly one of the first things, being able to communicate, who you are, why you're interested in this job, what you think you bring to the table, what experiences have you had, so I think just at a core level, being able to be kind of, articulate and be comfortable communicating, just at a broad level. That's like the first thing that pops through. And when you're dealing with entry level positions, like, you're not just going to hire the coolest person, right? If people are a little awkward, that's fine. But like, even through the awkwardness, you still want them to be able to effectively communicate, right? Who they are, what value they bring, why they're interested in the position, right? So I think just like, and you can literally sit there and look in a mirror and talk, right? Like, So I think communication is one really big key. Something that I've seen, and I do this myself. If you rewound the tape on this, I'm sure my crutch words are littered all over this thing. But one thing I've really seen with young people coming into the workforce is the overuse of crutch words. So these are like, you know, and I think when people are feeling, or you're asking people to talk about themselves or about something that's a little bit qualitative or subjective, it's very natural for them to go back to crutch words and be like, you know. So, but just try to cut that out as much as possible, because it's like, and I'm telling you not to do it, I'm doing it a little bit.
Right.
But as much as you can cut that out, the better. Just because if you do it too much, it doesn't sound great. But I'd say be prepared. Look up practice questions. Like, there are a number of interview questions that you can find online that you should have written out answers for. So write out those questions, write out your answers, be able to deliver them, not memorized where you're a robot, but like, you know, that if someone asks you about name 3 skills or name 3 experiences, whatever, you know exactly what you're going to say. So be prepared, practice your communication, you know, try to be as clear and articulate as possible. Just be comfortable in your own skin. I think preparing helps people be comfortable. You know, and don't be afraid to say, you know, I don't have, you know, I may not have, you know, that much experience. It's an entry-level position, but I will work hard and I will be coachable. If you can convince for an entry-level position them of 3 things, you will get that job almost every time. I'm going to show up and be on time. And I'm going to do, whenever you ask me to do something, I'm going to do it. I'm going to be coachable, and I'm going to try hard to learn. I'm going to be a quick learner, right? I'm going to be on time, quick learner, and be coachable. That's really all you're looking for in an entry-level position, right? So I'd say just figure out a way to take your past experiences and what you say and communicate those 3 things to them, and you know, you'll pretty much get the job, I would imagine.
Yeah, I think that's incredible advice. Prep. And that's not something that comes natural to us, you know, but I agree, you know, looking up those questions, what are they likely to ask me based on what this job is that I'm applying for, or internship, or whatever you're applying for, and then try to think about your answers before they put you on the spot and you end up, like you said, with all those crutch words, which, you know, we can explain away when we're doing the interview and we understand they're nervous, but there's a difference between being nervous and unprepared, for sure. So,
yeah, exactly.
Okay, so I think this is a hard one to ask, but you take this question however you want to. Normally, I ask what the job outlook is for your occupation, and you know, we could take that towards nursing, we can take that towards med device, or however you want to do it.
Yeah, you know, I'd say broad, like, you know, the job outlook, I'll say for entrepreneurship first, is high, continues to be high. You know, people there, I think it's like over half the jobs in the US are with small businesses, right? Are people, or over half of the people employed in the US are employed by small businesses. So, you know, I'd say the outlook is very strong for entrepreneurship. I mean, I think you know, you don't have to be, you know, curing cancer or have a global product to be an entrepreneur. You can have a really nice service where, you know, you could start a plumbing business, right? Or a welding business, and in your town, and that's entrepreneurial, right? So I think, like, you know, I would say think about entrepreneurship in a broad sense of, you know, you're creating something that's generating value. You know, you're starting a business. It doesn't have to be, you know, patented products. It can be something that's, you know, unpatented, or a software, or a service, or whatever. But the occupation, you know, the occupational outlook for entrepreneurship has never been brighter. It's never been, there's never been more resources at your fingertips for starting a business. But I would say nursing too. Nursing is a great occupation. You can get into anesthesia. You can get into sales. You can get into marketing. You can travel. So I think nursing is proving to be an incredibly versatile, you know, job where if you want to travel 100% of the time and make crazy money, you can do that. If you want to work anywhere where there's people, there will be a job for nurses in that location, right? Because people need nurses. So I just, you know, short plug there. I think nursing's, you know, far undervalued. It's been undervalued for a long time. It's been better valued in the last couple of years. But the job outlook for that's great as well. But yeah, I don't know if that answered your question, but I think for entrepreneurship and nursing, both are looking bright in terms of the outlook.
Yeah, yeah, that's great. So closing out with kind of a question about, are there any opportunities with you or within your organization currently for any internships, paid or unpaid, job shadowing, mentorship? We know those things are super important to better understand these industries that we want to get into, or careers, before we jump into them.
Yeah, I'd say, we usually have an intern, maybe not year round, but we usually have an intern that and we have one right now, the engineering intern. So I'd say we don't have any current internship opportunities. I'd say for mentorship opportunities, I'm always I have an open door policy. If anyone ever wants to kind of get a hold of me and talk about anything, have an open door. I know Nim, who's our COO at the company, he kind of has a similar approach, but definitely open to mentoring people, students. If there's ever anything we can do to help, and I know if there's students that are particularly interested in what we're doing, we could get all on a Zoom call again, right? And kind of ask more specific questions. So our company, we try to help out wherever we can, especially when it's with aspiring entrepreneurs or students, and these types of mentor opportunities, we always take them up. So
that's great, Spencer. Thank you so much for offering all of that. And I know it will be a big benefit to the students and young people who are listening. So, well, that's all the questions I have. Is there anything else that we may not have touched on that you want to share before we say goodbye?
No, I just, I think if you are interested in entrepreneurship, right, like, I would say that is an awesome interest to have, and I'm glad that and I'm glad that you have that interest. I would say just keep developing your skills and keep leaning into your aptitude, because it's kind of like one of those things, like, it's hard to find it if you're looking for it, kind of deal. Like, you don't just right, you have to be kind of building your knowledge and building your skills and getting exposure within an industry to then kind of that's like the mining for gold, right? And then you find that idea or you find that gold nugget, right? And then you can capitalize on it. But it's hard to find that entrepreneurial idea, if you're just panning for entrepreneur dirt. You have to be in an industry, getting your hands dirty, right? So even if you want to do entrepreneurship, just keep leaning into, whatever you're interested in, and then kind of have that problem solver approach, right? Like, don't, and if you keep doing that, I've no doubt you will find an opportunity, a problem to solve, right? So I would just say that, yeah, if entrepreneurship's interesting to you, just keep working hard and building your knowledge and skill set, and you will stumble across that, that eureka moment sooner or later.
Perfect. Well, thank you so much, Spencer. We'll talk to you soon.
Yep. Thank you, Danielle. Take care.